In light of the above, the following are the sets of regulations that are being drafted or amended. Firstly, the regulations relating to surveillance and control of notifiable medical conditions. Secondly, the regulations relating to public health measures in points of entry. And then the regulations relating to the management of human remains and regulations relating to environmental health. Just to indicate to honorable members, as we have been indicating that the surveillance regulations is not the new regulations, but however is an amendment of the regulations, and we have done a table that at least show the regulations of 2017 and the proposed draft regulations for 2022. In terms of the 2017 regulation, we had Regulation 16 that provided for mandatory medical examination, prophylaxis, treatment, isolation, and quarantine. And it is critical, maybe just to indicate that this part of the regulations, Regulation 15.1 to 6, have not been amended and therefore is still applicable. The amendments that have been done to this section have been done by way of addition. And the addition is from Regulation 15A to 15H. The Regulation 15.1 of the existing regulation provides or require for medical examination, prophylaxis, and treatment, but that has to be determined on a case-by-case basis and has to be tailored depending the public health risks and individual circumstances of the person. However, what we have done, as we have indicated, to say that the 2017 regulations were not geared to deal with the pandemic, we have then added 15A. That then deal with the refusal for medical examination, treatment, prophylaxis, and isolation and quarantine. These regulations provide that a person who is a confirmed clinical or laboratory confirmed case for a notifiable medical condition or is suspected of having contracted a notifiable medical conditions or has been in contact with a carrier may not refuse medical examination, including but not limited to the taking of bodily samples, which may be authorized by any law or be admitted in a health establishment, quarantine or isolation site. What is critical is that there has to be authorization by law. So this should not be an arbitrary position. That is why it is clear that the regulations provide that there has to be authorization in terms of the law. And this is aimed at preventing the transmission of notifiable medical condition. And in terms of the 2017 regulation, sub-regulation 2 authorizes the head of the provincial department to apply to a high court for an appropriate court order. If a person who is a clinical or laboratory confirmed case or carrier of the notifiable medical conditions refuses to consent to medical examination, including the taking of biological specimen, or refuse to be admitted at a health establishment, or for a mandatory prophylaxis, treatment, isolation, or quarantine. As we have indicated, this was meant for an individual and a case-by-case basis, and it was not meant for the pandemic. We have then introduced in the 2022 draft regulations the provisions that deal with isolation and quarantine of persons, and to provide more information as to how should isolation and quarantine be done. These regulations provide for isolation or quarantine. It also provides for both self-quarantine and self-isolation for those who meet the criteria set up in Regulation 15G. And this was meant to, and with our experience, that there were people who felt that they are able to self-quarantine and to self-isolate, and therefore a criteria was necessary for self-isolation. These include that the facility must at least be separate with well-ventilated bedroom, with a bathroom and a toilet, and that they should not be shared with any persons who are not subject to quarantine. And therefore, the meals provided in the facility must be served on a room using disposable utensils that are kept separate because as a control measure. And then the facility must have a thermometer that will allow for a person to measure his temperature on a daily basis. Because this person is not monitored by health professionals, therefore it is critical that at least these measures are there so that if there are other issues or the temperatures rise dramatically, then at least they can then make a call so that at least they can be taken care of. The criteria for self-quarantine or self-isolation was not in the 2017 regulation, as the quarantine and isolation was done at a health facility. So that's critical to also take note. If a person refuses to quarantine himself or herself or to travel to a site of isolation or quarantine as directed, a court order must be obtained to compel such person to quarantine or isolate. And this is just to indicate that instead of having the head of a provincial department to apply to a health court, will still want to have a court order so that at least the person, if they have to be forced to go for a mandatory isolation or quarantine, at least there is a due process in terms of the court processes.
Quite a technical one, but we'll continue following it there. The Health Ministry reporting or briefing the Health Portfolio Committee in Parliament. A quick break, we'll be back in a moment.